Hello, Wake Up New Zealand, Karasaki speaking. Well, we all know that this government in New Zealand tells all the lies going and the non-transparency around the increase in deaths post-COVID-19 jab rollouts. Well, interesting. Some states and US are actually really onto it because I'm going back to a state report of Florida Health, the government department, communications office, news media in February, 15th of February 2023. And it states that the report is 1,700% increase in Vaers reports on the rollout of the COVID jabs, referencing the state surgeon general notified the healthcare sector and the public of the substantial increase of vax adverse events reporting Vaers in Florida after the COVID vax rollout. In February alone, there was a 1,700% increase in Vaers reports after the rollout of the COVID-19 jab. Now, that was compared to the 400% increase in the year before as to the Vaers reports on the adverse effects to COVID-19 jabs. So the reporting said the reporting of life-threatening conditions increased over 4,400%. They say this is a novel increase and was not even seen in 2009 when the H1N1 vax campaign happened. So the state surgeon general states there is a need for additional unbiased research to better understand the COVID-19 jabs, short and long term. The findings in Florida are reported to be consistent with various other studies. So they took on 3 studies, and they can continue to uncover high risk adverse events and mortalities. After evaluating, the state surgeon wrote a letter. He wrote a letter to the FDA and the CDC, illustrating the risk factors associated with the COVID-19 jab, mRNA, emphasizing the need for additional transparency. And the state surgeon general referred to a number of studies associated with the excess risk of serious adverse events, including coagulation disorders, acute cardiac arrest, other cardiac acute events, Bell's palsy, encephalitis. In one of the studies, the risk was one in every 550 individuals, which is much higher than in any other vaccine studies. Another study found increased acute cardiac arrests and other acute cardiac events following the COVID jab. A third study related to COVID-19 vax found preliminary evidence of increased risk of coronary disease, cardiovascular disease. So the CDC had already identified that those people over the age of 65 and over are at risk of the safety risk that have been identified of having a stroke. So that was around the booster administration and referred for the need for further assessments and research regarding all COVID-19 vax mRNA. So the state of Florida is remaining as a healthcare provider to accurately communicate the risks and benefits of all clinical interventions to their patients, including those associated with COVID-19 and with other public health concerns, to promote importance of treatment, promoting prevention, healthy habits like your diet, exercise, etc., encouraging healthcare providers to do the same, to support transparency, including those associated with COVID-19 vax rollouts, as additional risks continue to be identified and disclosed to the public. So they are disclosing these risks to the public of what is happening here. To support transparency, the state of Florida reminds healthcare providers to accurately communicate with their patients the risks and benefits of all clinical interventions to their patients. And any COVID-19 additional risks are to be continued to be identified and disclosed to the public. So the state of Florida in the department, this is nationally accredited as a public health. So they are nationally accredited as a public health department by accreditation board, works to protect, promote, and improve health of all people in Florida through integrated state, county, and community efforts. So what they also said that similar studies are showing the same as what they have. So we don't have that in New Zealand. It's hardly ever seen across the world. I just had to tell you about this, of what the state of Florida is doing. Wake up, New Zealand.